Hello, everyone. Welcome back to another episode of the MSNS podcast. I am your host, Ryan Lim.
And I am your co-host, Alan Tan. And I know you guys have been missing us. A lot of things have happened since the last podcast, and today we're just going to discuss a little bit about that.
Oh, really? Interesting. Alan, can you tell us a little bit what happened to you during winter break? I feel like that's
So,
a lot more interesting than what happened, and nothing that happened to me.
so as you guys can see, right? So my jacket right here, I only have one side of it on because I actually broke my arm. So I know it's been what? I think I broke my arm
New
New
Year's
Year's
Eve?
Eve. I
Yeah.
broke my arm New Year's Eve. So it was 2020 giving me a last hurrah before I could go into 2021, you know? But having that mentality going in has helped me a lot through this recovery process because I didn't think of it as like an unfortunate thing. It was just like an experience that I needed to go through, or like something that 2020 had ready for me the whole year.
Oh,
And I
man.
just had to push it through before I could, get
Jeez.
get into 2021. So it is what it is. I technically just had an early exposure, an early experience into med surge because I was there. I was actually there for 2 days, but I was glad that I was able to do um, surgery the day of because my fracture. So my fracture, I had fractured both my radial and my ulnar bone. So I have plates on both of them and 6 bolts in each. So they're not getting removed. They're just going to be there forever because those two bones are very prone to injury and they break easily again. So my surgeon was like, "Yeah, we'll just keep it." And I'm just like, "Okay, that's cool. I don't mind."
And
Yeah.
and before we talk about maybe like exactly what happened in the hospital, like post
Yeah.
surgery, can you tell us a little bit about what happened, like what caused the injury, and maybe just like how are you feeling in that moment, like right after
Okay.
what happened? I just want to know.
I
I'm
can
sure the
we can
viewers
run
want to
through
know.
the whole story, like the whole
Yeah.
process of me like calling the ambulance and like going into the ER and everything. So I was riding my bike. I was getting some groceries, and on my way home, I was riding down this hill, and it's not a very steep decline either. It was pretty normal for hills in San Francisco. So what happened was I was going down, um, and I guess my bike got caught in like a little ditch that I didn't see. And then what happened was I think my the brakes on my bike locked up for some reason, and then I just ate shit from there, man. As soon as I felt the bike stop and hit the ditch, in my head, I knew. I was like, oh shit.
Man.
Okay, fuck. Okay, something's gonna break,
Mhm.
right? So as I was like, I don't know how I felt, but I'm pretty sure because only my right arm was injured, nothing else was injured. I I either leaned to one side or I flew off my bike a little bit and then landed on my right arm. So that's how my right arm got broken. Um, yeah, and as I landed, I heard a crack. I was like, "Oh
Oh
man!" I was
no.
like, "No,
No.
I cannot, dude. Like, why does it have to happen now? Like,
Man.
out of out of so many days, has it happened right now, New Year's Eve?" I'm just like, man, whatever, man. So as soon as I got up, all the adrenaline was pumping and everything. I was like, okay, what should I do now? So my first thing to do, because my bike was on the road, I tried to put it up, and I noticed that like my right hand was pretty. Um, I could not use my right arm. It was just like super floppy. I was like, okay, yeah, that's the arm.
Man.
And I was like, all right, I just won't do anything with that. And then I got my bike up, but not on the sidewalk because I wasn't able to lift it yet. I really wanted to, because that's just like the stubborn person I am. I wanted to use my right arm, just to pretend
Mhm.
it's not broken or anything.
Yeah.
But that didn't happen. And what happened was I was sitting on the sidewalk, or on a ledge near where the pedestrians walk, and then I just sat there. Um, the first thing I did, I knew I just couldn't let my right arm just hang there. So I was sitting in a position where I was able to elevate my right arm so it wouldn't move with my right knee. Um, and then I called EMS, emergency medical services. I also called my friend so he could pick up my bike. And that's when I started going onto the ambulance, and they started asking me all those questions, like
Mhm.
all those intake questions, like, oh, what happened, your name, everything like that. Um, and yeah, they just took vitals and everything. And next thing you know, I was in the ER just chilling.
Just
Yeah, just chilling. There wasn't a lot of people there too. I was surprised because it was the holidays. I would expect more like COVID patients or whatever. But I think that they have a different unit to go to because I went to CPMC, Mission Bernal. Um, yeah, I was in the ER department. It seemed pretty chill. I was in there for a few hours at least, just getting ready for surgery and having different doctors come and take a look.
Mhm.
So my fracture was an open fracture too, which was why I had to stay in the hospital for 2 extra nights because I had to be on IV antibiotics, which is really interesting. Um, but yeah, that's about it.
And I know you were saying how like, you know, it was kind of surreal when they started like the people on the ambulance, like the paramedics or EMTs were asking you the questions.
Yeah.
Was it weird being on the other side? Because usually we are the nursing students trying to be nurses, taking care of these patients, but now, everything's kind of flipped where even, since you were still with it,
Mhm.
it was just like, whoa, this is weird because usually I'm the person doing that. And like I know
Yeah.
all the questions you're probably gonna ask. Like this is crazy. I feel like, how is that for you?
It was more like, how would you say, because I knew what was going on, that I just tried my best to help them. You know,
Yeah.
I know what they wanted, so like when they were asking me about all these types of things, I was like, "Oh, do you guys would you guys like my insurance card, my ID?
Mhm.
It's in my wallet, so you guys can take it from there." And like, oh yeah, 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 perfect. I'm like, "Oh yeah, here you can do it on this arm," and I like the blood pressure cuff and like the pulse oximeter and everything like that. I was like, "Yeah, you guys can do all that. I understand what they're doing." They're like, "Oh, really?" And I'm like, "Yeah, I'm a nursing student." I'm like, "Oh, that's super cool."
Mhm.
Like, yeah, just do whatever. I'll help you guys out. I know what's
Mhm.
going on. So
Nice.
I just wanted to be like the ideal patient for both the EMT people and the doctors and nurses in the hospital. So I feel like when you have a background um, in this, it's a good and bad thing too, because sometimes you understand what they're doing wrong or what they
Mhm.
could have done better. But at the same time, like it happens and you kind of have to understand where they're coming from.
Yeah.
And it was just yeah, it's just a really surreal experience. I would never think I would be on the other side
Uh-huh.
being taken care of,
Mhm.
and uh, just a really interesting experience to get me into med surge too,
Mhm.
because I was admitted into the med surge unit after my surgery. Yeah.
And what was that? I don't know. I'm trying to think because I feel like that is that thing that I've heard from a lot of nurses and nursing students, or even just people in healthcare in general, where,
Mhm.
because we are the ones getting trained to take care of these people, there does, you know, there is this feeling of, you know, invincibility sometimes that we have that we kind of feel like, oh, it's never really going to happen to us. We're just taking care of the people that it happens to.
Yeah.
And I think once it does happen to you, something where land in the hospital or whatever, I think it does, strip away some of that invincibility and it does leave you a little bit more vulnerable. But at the same time, I don't think that's ever a bad thing.
Yeah. I
I think
agree.
it can be very
I
scary,
agree.
but I think
Yeah. Yeah.
yeah,
Yeah.
yeah. But at the same time, I feel like it's very humbling to realize that, you know, whatever can happen to them can happen to me. So,
Yeah. I feel like that message is good for those nurses that are still, I don't know. in my opinion, I feel like sometimes as a nurse, you have this, I don't know, this hero complex where you're always going out of your way and putting yourself um, in front, putting other people in front of you.
Yeah.
Like during this pandemic, I know I've read a few stories on the internet about how some nurses are putting themselves on the front line because they have this hero complex, which I honestly don't think is the right mentality to go into as a nurse, because first thing first, you have to really take care of yourself.
Mhm.
Like you as a person is just as important as the next person. You know, it's always really important to take care of yourself and understand your own limitations before you can go ahead and take care of other people.
Oh yeah.
Because you know it's your own life, and I feel like uh, a lot of nurses need to hear that.
Mhm.
Like just putting yourself in front of others sometimes puts you in a situation where you don't want to be,
Mhm.
and it ultimately just affects you negatively. And I don't want that to happen to
Oh
any of
yeah.
the people around me. So knowing that how selfless they are,
Mhm.
it's really important to let them know that they're just as important.
Yeah. And
Yeah.
I think it's super hard to get that message across though, because I've said that to, hundreds of people before, like so many nursing students, but at the same time, I'm still working on that. Just because I give you this advice doesn't necessarily mean that I have all my shit together as well.
Yeah, exactly.
Yeah. I think it's a very long process that you're not going to, reach the end once you graduate. I think it's a lifelong process, whether you're a nursing student, nurse, NP, or so on and so forth. Like, I think you're always going to be experiencing new things in the world and in the hospital that could lead to this internal conflict between taking care of others before taking care of yourself. And I think, it's just up to you in that moment to, just gotta recognize what's important. And, I think the most important thing is yourself. Yes, you should always take care of other people, but like we have a moral and professional obligation to take care of others. But I think in no way, shape, or form will you be able to do that unless you're stable mentally and physically. Yeah.
Yep. Yeah. It's just that I just can't. It's unfathomable how sometimes I've read that some nurses really, like, despite having COVID and despite them having pre-existing conditions like diabetes or like hypertension or whatever, um, they really put themselves out there to help other patients, and in turn they caught the disease, and they passed away.
Mhm.
There's no way around it, and I feel
Yeah.
like they could have avoided that if they didn't have that hero complex,
Mhm.
and really just went out of their way and say like, learn how to say no. And like that's one
Yeah.
of the also one of the things that I think that nurses really need to learn how to do, is that you have the the power to say no. Like if you
Mhm.
feel uncomfortable with it, say no.
Yeah.
Right? If you feel like you're being taken advantage of, just say no.
Mhm.
And it's something that I think, especially us um, in the healthcare profession, it's something that we really need to learn how to do,
Mhm.
because that's one of the most important things to prevent burnout and be the best you can be when you're on the floor doing your job.
Yeah. Know your limits.
Yeah, exactly.
Mhm. Yeah. Yeah. I feel like that's a very, your story is a very good story to see, I guess, start off the new year and the new, I guess, a
Yeah.
new season of the podcast.
Yep.
Do you feel like that experience in MedSurge is gonna change how has that changed your view on MedSurge at all, or maybe your outlook on your future goals as a nurse? Do you think you're more interested in MedSurge as a result of that?
Oh, I'll take one point at a time. Like I feel like I'll talk about your first point. Like,
Mm,
has it changed my perspective about like med surg? I think it actually changed how I want to treat my patients,
really?
because despite me being there for a few days, I feel like sometimes um, I needed a little bit more care than I presented myself to be. So I know that because that's the case, some patients might be the same, and then the nurses be like, "Oh, they're very like they can do everything themselves. Like they'll be fine. You don't." you know, you don't have to really take care of them or whatever, or you don't have to really keep an eye on them too well. Um, because I do feel like, despite that, nurses should still come periodically and just check on you if you're doing okay,
Mhm.
rather than just press on the, you know, the call button and then
Mhm.
have someone come by. Like periodically, just coming to check in, especially during COVID,
Yeah.
where they really don't have anyone else there to really take care of them. Because the 2 days I was at the hospital, I was there by myself.
Mhm.
I couldn't have any visitors, and if anything needs to be brought up, like for example, I need a phone charger or like my laptop to take a look at emails, I had to tell someone in my family or within my friend group to drop it off at the hospital instead of them coming up.
Mhm.
And that was just something that affected me mentally, because I was like, damn, I really do miss like just having human interaction that's not with a healthcare professional. And I feel like nurses can provide those patients the ability to really, you know, connect with them that way during a time like COVID where they can't really see no one.
I know.
um,
Yeah.
and it was just like sometimes when I actually needed help, they did come on time. It was just really tough, just
Yeah.
tough being a patient during COVID, man.
Mhm.
It's just really hard, to
Yeah,
say the least.
but I feel like because you've been on both sides, you're kind of, I think you're a lot more considerate,
Yeah,
understanding, because you like,
exactly.
because if you're the, because even though you were a patient and sometimes you weren't, the nurses or the staff weren't helping you timely, even though that is a major problem, you also understand like,
Yeah,
hey, I've been on the other side where like maybe I'm
yeah,
swamped with other
yeah,
other patients or like
yeah.
paperwork, charting. And then on the flip side too, where you're the nurse, and but since you've also been the patient, you have that empathy, you have that
Yeah,
connection, like,
exactly. I
right.
understand. Like, despite me wanting um more time with the nurses, or like I wanted them to help me a little bit more.
Mhm.
I just knew that they had other stuff going on at the time, and it was just that made them unable to provide, like, how would you say, not the optimal care, but just, you know, the care that you learn to do in nursing school, if
Like
that makes any sense.
standard care, is that what, I don't know.
It's not standard because they were doing standard care. It was just like going above and beyond, you know,
Hmm.
like what you learn in nursing school.
Oh yeah.
Yeah.
Okay. And how about my second point, where do you feel like your experience in med-surg, you think it's influenced you in any way of going in and pursuing that in the future, like once you graduate?
Um, I feel like my future, or like my planned road ahead for nursing, is more of me just trying to get experience right outside of nursing school.
Hmm.
Because ultimately I want to do something with geriatrics or something within that area, because I'm actually really passionate about that. Um, excuse me. But I also do want to work in like a med surg unit on my first few years, because I'm
Hmm.
actually really interested in it.
Me too.
And because
Yeah.
it's like it's high intensity, like it needs a lot of knowledge, and you get to learn a lot with different patients coming with different conditions. I feel like having that framework, having that how would you say, yeah, just having that framework
Mhm.
laid down for you is really important as you continue on in your nursing career. Because in my opinion, like as much as I want to do, as much as I want to just go into geriatrics or maybe into pediatrics or whatever, I won't have the skills that I feel like I can acquire, or
Mhm.
to be an optimal nurse in those units.
So it's kind of like, rather than going into specialty right away, you would rather kind of
Exactly.
go into something a little bit more general or broad, get
Yeah.
that foundation going
hmm
before you go into something more specific.
hmm
Okay, I
That's
see.
correct.
I agree with that. I agree with that. I feel like, yes, if you want to be someone who's in the ER or ICU or whoever, like a specific specialty, I think it's, if you're very passionate about it, it's hard not to be like, oh, I want to get it into it right
Yeah.
out of nursing school. And if you have the
Yeah.
opportunity, go for it, right? But I feel like, you know, I think those opportunities are hard to come by, especially in
hmm
the Bay Area. And I don't think anybody should ever feel like they're settling if they get a med-surg position. I feel
Yeah.
like
Yeah.
I don't think that's settling at all. I think that's just another amazing opportunity for you to build that foundation
Hmm.
and,
I agree.
slap that on your resume and say and present that during your interview at the ER, ICU, or wherever. Be like, hey, I have this foundation, I have this experience, and I think I am very competent and capable of utilizing those skills in the ER, ICU, peds, wherever.
Yeah, I agree. Because just being in a med surg unit, my sophomore, I think my sophomore two, that's when our last med surg
Mhm.
was.
Yeah.
Yeah, just being in that situation made me really think and made me really uh think to the best of my abilities of how to take care of certain patients. Um, I feel like you get a lot more knowledge that way
Mhm.
before you go into a specialty.
Oh yeah.
Yeah.
Yeah. It's crazy. It's crazy how much, I don't know if empathy is over, but it's just crazy how you can definitely get a greater connection with a specific type of person or
Mhm.
population when you've been in that position as a patient.
Yeah, yeah, I
Like,
agree. I agree. Like being in that situation over the years really helped me understand how certain patients are feeling
yeah.
um, when they're in the unit. Um, yeah, it's just really humbling experience. Like as a student nurse and
Mhm.
as like an aspiring featured nurse, it really puts into perspective like how it feels to be a patient
Oh yeah.
in that situation. Yeah,
Yeah.
because
Like,
a lot of things are going on in my head, like a lot of stress and everything. Like, oh,
mhm.
am I still able to do my clinicals, or like, how long will this take? You know, like how is my family feeling? Like, am I able to see my friends soon? You know, and it's just all that mental turmoil really, you know, weighs you down sometimes,
Mhm.
and especially not having visitors,
Oh yeah.
it was just a lot more
That's
tougher.
rough.
So I feel like I can take that experience into my junior two med surg experience and really connect with my patients a little bit more
Oh yeah.
because I know that they need um, that connection more than ever.
Yeah. I feel like for me, I think I have that connection with people who have like cardiac patients or people with like heart
Mhm.
problems.
Yeah.
Like, yeah, because of just my past thing with my
Oh yeah. Yeah.
like for people who don't know, I as a child I had a heart condition called WPW, which is like Wolf Parkinson White, which is when there's like, I think I was born with it, where you have an extra electrical pathway in your heart and it causes um the electrical impulse to have like a shortcut. So instead of going all throughout your heart, it just goes around and around and just makes your heart beat so fast and the blood's not circulating. And my heart would beat like 220, 240 beats per minute. And I would start blocking out and stuff. Like it happened in elementary school at first. And that was not fun at all. Cause how would I say? It's just, I don't know. As a kid, the first time it happened, you just realize you don't even know what's going on with your heart. There's
Yeah.
I don't really think I knew.
Super scary.
Yeah, it was super super scary. I remember the first time it ever happened, I tried to sleep it off. I was like, "Oh, I don't know what's happening, but I'm just going to go to my bed and sleep." 10 hours later,
Yeah.
I couldn't sleep and
Damn.
I was like, "Mom and Dad, let's go to the hospital because I don't think
Yeah.
this is okay."
Mhm.
But yeah, and then I found out shortly after that I had this condition and it was weird to kind of decide like, oh, do I want to be on medication for the rest of my life or do I want to get this procedure done to just stop it completely? And I think, trying to decide that as like a 8 or 9 year old, you know, like I think in the beginning I chose medication because I was super scared
Yeah.
because I didn't know what surgery
Yeah.
meant. They were like, oh, we were gonna put this catheter up your blood vessels and into your
Mhm.
heart and either burn or like it's an ablation where you burn or freeze that specific tissue that was causing the electrical pathway. And I was very scared when they explained that. I was like, excuse me? Like, no, I'm not going to do that. So, but then I think, after just talking with more of the doctors and the nurses and my parents, I ultimately chose to do the procedure because I knew that the medication was a lifelong thing. But
Yeah.
if I did the procedure, it's just like a one time thing.
Yeah.
But little did I know that, it would come back in high school.
Oh,
It
damn.
was weird. Like all throughout middle school, I was fine.
I see.
I tracked basketball, nothing was wrong with my heart. But
Cool.
then freshman year of high school, all of a sudden, it just came back. I was doing a
Uh-huh.
presentation for like my computer or whatever class, and all of a sudden, I just feel my heart racing, but not like the nervous kind of way, just like the 240 beats per minute kind
And
of
you're just like,
way.
damn, this is not. It's like the unnormal type of
Yeah.
way, the abnormal type of beating. Yeah.
Yeah. And like, you know how like for those with like seizures, some of them like before it happens, there's like an aura. They've had this aura.
Yeah. Yeah. Yeah.
I
Yeah.
think I had that too, where I had like this strange feeling where I knew was gonna happen right before.
Mm-hmm.
So whenever it did happen, and I was like in the hallways or whatever, because it would happen randomly. There was no real
I see.
trigger. I would just like either hold on to my friend or to my friend, like, hey, like it's
Mm-hmm.
happening again. And like I might faint because
Mm-hmm.
if my heart is being like 240, 250 beats per minute,
Oh yeah.
the blood's not necessarily circulating to the rest of my body and I might be
Yeah.
blocking out. And yeah, I would always tell my friends, like, hey, just like catch me if I fall. So I got the exact same procedure done again
Mm-hmm.
when I was like 14. And ever since then, I've been okay. But
Okay. Okay.
I feel like that whole 7 year long, 8 year long
Mm-hmm.
experience really did create this internal trigger where whenever I do see a patient, whether they're in pediatrics or especially pediatric cardiology,
Mm-hmm.
there's just something in my heart that's just like, oh my god, I got like I don't want to be biased, but I want to take like extra care of you because I know exactly how you feel. Like I
How
feel
you're
you, dude.
doing, how you're going through. Yeah.
Yeah, I totally feel you. It's super scary. It's the weirdest thing because you don't, as a kid, you might not necessarily understand everything about the heart yet.
Yeah.
And then there's just this random thing in your body that's just beating super fast and making
Yeah.
you faint.
Yeah.
So I definitely do, whenever there is like a cardiac patient or a
Mm-hmm.
patient in cardiology, I definitely try to like look up their conditions more. I hate saying that I did it more because it's biased, but I've definitely been more detailed in my research with
Okay.
cardiology patients and try to explain it to them, just to kind of relieve some fear and
Mm-hmm.
just help them as much as I can.
Yeah.
Yeah. But
Yeah, like how you say about how having more sympathy or just pay more attention to cardiology patients. It's just what happens. Like you
yeah,
understand their condition, you
yeah,
understand what they're going through, what they need. You just just trying your best to help them feel as best as they can because you're in the same situation and you
mhm,
understand how they feel and everything. Um,
yeah, yeah. I feel like it's something innate. Like you never want to be biased towards a specific type of
yeah.
patient, but it's just like, oh man, I feel you, dude. And I think that's the great thing about nursing school and just like
Mhm.
being in med surg, like you said, the more you experience, the more you're able to
Yeah.
connect with patients on a deeper level. Whether it's through their diseases or conditions, or maybe something beyond. Like maybe if you're someone that's into music or art or sports, and they're also into the same things, you're able to connect with them on a deeper level.
Yeah, I feel like that's also one of the major things that I feel like we as nurses need to do a little bit better is just like finding better connections with the patients.
Mm-hmm.
Like just talk to them, man. Like I remember, I think last year in my med surg rotation, because I was a San Francisco native and because I grew up near the Fillmore, because that's where I swam and I'm like a big part of the community over there. Um, like this lady was like, "Oh no way!" Like, "Oh, you're from SF? You do sound like you're from SF." I'm like, "Yeah, I grew up in the Fillmore." She's like, "No way! I live near around there." I'm like, "Yeah." Like, I swam at the pool and everything. She's like, "Oh no way!" She's like, "Oh," she's just telling me all these stories about like
Mm-hmm.
how she grew up in the Fillmore and everything. I'm like, "Oh, that's so cool." And then she's like, because then I was there to take her blood sugar levels, her glucose levels, and everything. She's like, "Oh yeah, just do it. I know you can
Uh-huh.
do it." I'm like, "Yeah, I got you. No worries. Come on, man." She's like, "No, I trust you." I'm like, "Oh,
Mhm.
thanks. I appreciate that." Yeah, and also, I think being of Asian American descent, being able to speak Chinese
Oh yeah.
really,
Mm-hmm.
really puts at ease. At least in my experience, puts at ease like the Chinese patients, because they understand that you know Chinese and you've been around how Chinese people are,
Mhm.
because they have a lot of beliefs with like about Western medicine and
Mhm.
Eastern medicine. They have a lot
Yeah.
of conflict when it comes to that. And being of Asian American descent and being Chinese, I understand it. And because of that, I feel like I can connect with them a little bit deeper in that way.
Mhm.
Um, yeah, and we just don't, you know, like in the Bay Area, we have such a large Asian population.
Yeah.
Those type of those type of thoughts don't just apply to Chinese, but also to other Asian ethnicities. You
Mhm.
know, um, yeah, man, it's
Yeah.
just it's just really interesting to see when you go into a patient's room and you connect to them in a certain way. They feel a lot more at ease,
Oh yeah.
because it's a really scary situation when you're in a hospital or a place that you're not so comfortable with, you're not familiar with, right? Um, it's a really weird experience for them, and it can be very daunting and very scary.
Mhm.
Um, like it wasn't that for me because I understood what was going on, but for them, a lot of the times, more often than not, they don't understand what's going on with them.
Mhm.
Like, oh, what are they doing with this blood pressure cuff? Like, what is this gonna do? Or like, oh, what? Why is this IV there? And why is it? Excuse me. Why is it leaking a little bit? And everything like that. And they just don't understand how certain procedures go, and it just affects them negatively and makes them have a bad experience at the
Oh yeah.
hospital.
Mhm.
Yeah, which I really never want my patients to have. I want them to try to be as comfortable as possible and know that they're getting the best care as they can.
Yeah, and I feel like I'm super excited because I feel like as nurses, we do definitely get a little bit more time than maybe
Mhm,
other, health professionals when it comes to our patients. And I
mhm,
think that little bit of extra time is going to go a long way because in order to find that similarity, that connection at the start, you have to start talking to them, And I
yeah,
feel like once, you just get a simple conversation going, I and you find something, a similarity or just a connection. I think it really does help them to break down their walls a little bit and allow themselves to be a little bit more vulnerable with you, you know.
yeah, exactly.
Yeah, like I love that no matter where you are, just having like one small simple connection, like just having the same like liking the same sport or liking the same
Mhm,
basketball team, it transcends any race, ethnicity, or like individual differences.
mhm,
And I think that's just amazing. I think we're very fortunate in the Bay Area to be so diverse and
mhm.
have
Yep,
that
I agree.
opportunity. Oh yeah, it's amazing. Yeah, like even like I like how whenever I go into like a clinic or something
Mhm.
or whatever, and I see a nurse, and I'm just like, and then like it just comes across like they ask like, oh, what school do you do? Oh, I'm in like in USF nursing, and then once they hear I'm a
Yeah.
nursing school and they're a nurse, they like break it out. They're like, hey, what's up? You're a nursing student too? Oh my god.
Oh yeah, every time, dude.
I love
Like,
that.
oh no way. And
Yeah.
they're just like, I remember because I recently got COVID-19 vaccine too.
Mhm.
So when I was getting the vaccine, she was like, "Oh yeah, where do you go to school?" I'm like, "Oh yeah, I'm a nursing student at USF." And she's like, "Oh, okay, you don't need this spiel. You know what's going on." And she was giving me my shot. She's like, "Oh yeah, you're gonna feel a little pinch. I know." And she's like, "Yeah, I know. I'm just like, I'm just gonna shut up. I'm just gonna give you your shot." I'm like, "Yeah, it's cool."
Oh man.
Yeah, it's just we we have that connection, you
Mhm.
know. Like once you say that, they're like, "Oh, okay, I
Yeah.
got you."
Dude, honestly, the nursing student and like nurse or just like one nursing student to another nursing student
Mhm,
connection is just unbelievable because
mhm,
I think we know the struggle and I don't like saying torture, but just like the torturous things that we've gone
yeah,
through. And I think it's just nice to have that shared struggle
mhm,
and just create that bond, strike up a conversation. Like I can talk to
mhm.
a freshman, sophomore, senior in our program, or I honestly in any nursing program, and I feel like we can just connect immediately just by talking about the shit we've been through in nursing school.
Yeah, yeah.
Yeah.
Yeah, it was super interesting too. I was doing some physical therapy with my therapist, and she was like, "Oh," she was changing my bandages for the incisions, and she was like, "Oh yeah, what happened?" I was like, "Yeah, I was in the hospital for a few days to treat an open fracture." And she's like, "Open fracture? You know what that is?" I'm like, "Yeah, I'm a nursing student." She's like, "Oh, that's why." I'm like, "Yeah, like I knew what was going on, man." She's like, "Ah, okay, I see, I see, I see." You know? It's just
Mhm.
like having that connection is really special sometimes. You can connect to just, just random people, like your
Yeah.
therapist or like your patient. It's
Mhm.
just really cool. It's a really cool experience.
Yeah, and also just like a reminder that there are going to be a lot of times where you don't have any similarities
Oh
or
yeah.
any maybe possibly any connection with your patient or whoever. And I think that's when it's most important to just have that curious mindset
Mhm.
where maybe they don't like the same things that you do, but you maybe spot something in the patient's room that stands out, like a specific watch or a
Yeah.
picture or a painting, and just go ahead and ask them. Have that curious mind. Say, hey, what's that about? Like, are you into art, or like, is that your family member? Tell me a
Mhm.
little bit
Yeah.
about
Yeah.
them. And
Yeah.
I think it just helps the patient out, just being able to talk to anybody, especially
Yeah.
during this time of isolation.
Mhm.
Yeah.
Yeah.
But well, you mentioned that you got your COVID vaccine, right?
Yes, sir.
How was that?
It was a cool experience. I actually got it through my employer, um, and she recommended us to go get it. And I was like, oh, cool. As soon as it's available, I'm gonna sign my ass up to get the vaccine because, um, despite what people say, I actually really believe in vaccines and like believe in our healthcare system. So I
No
wasn't adamant.
microchip?
No, no, Mike. No, 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 dude. I'm getting AIDS, obviously.
Oh
Dude,
my.
it's crazy. We'll go into that a little bit later. But I was talking about the vaccine right now. Yeah, I was able to get an appointment with one medical, and when I got there, I was just pretty much in and out. Um, got the vaccine. They sat you in the lobby for about 15 minutes to see if you had any adverse reactions to the vaccine, which I didn't. The only thing that I felt was uh, just a sore arm, if
Mhm.
anything, just like sore around the side of the shot. Um, but nothing more than that. Because I know, like you said to me, you were feeling some symptoms when you got your COVID vaccine. So that's the only symptom I felt. And I will be getting my second dose in a few days. No, no, not a
Oh,
few days.
nice.
A few weeks. A few
Okay.
weeks.
Same,
So
same.
I will be COVID free. I will be COVID immune pretty soon. Immune, you know how vaccines go.
Yeah,
So
yeah.
I'm pretty excited about that.
Mhm.
And the experience was pretty chill. Um, I also got the Moderna vaccine
Mhm.
because I know you got the Pfizer one.
Mhm.
So we can talk a little bit more about that
Mhm.
because I know that you had some things going on with your vaccine compared to mine.
Yeah, it was quite interesting. I got it on Friday, which is like for reference, it's like January 22nd or something.
Yeah.
Or something. Yeah, like where right when I got the shot, it was fine. It was super simple. I stayed the 15 minutes. I was able to get it through the hospital that I'll be doing my clinical rotation at this semester, which was really nice of them to do.
Yeah.
But that, following night, something weird just happened, and I'm not trying to scare anybody. It's just literally just my experience. I think
Mhm.
everyone's gonna react differently or not react at all to the vaccine, but along with the slight fatigue and malaise, I just felt so out of it. Like even before this podcast, I was trying to tell Alan, I was trying to explain it, but it was just so confusing because I
Yeah.
barely knew what was happening. I just felt
Yeah.
like I felt like I was trapped in my own body where it was just like I just felt numb. Like I could raise my hand, I could do everything, but it just felt like I was like I had to actively control. Like how some things you just like
It's the microchips, my
it's the
guy.
microchips. Oh my god, guys. I'm, I'm going to the government. Oh wait, no, the government did it.
Yeah.
Never mind.
They're listening right now.
I know. Oh
They're not
shoot.
talking shit, my
Okay.
guy.
Okay.
Oh man.
Oh yeah, that's so funny. No, but yeah, it was super weird. But I feel good now. Like
Okay,
everything's
that's good.
fine.
That's
Yeah.
good.
And I'm also very relieved to get the first dose and the second dose in a couple weeks because I don't know. I feel like I don't know. We're very passionate about nursing. We're very passionate
Yeah.
about like taking care of people, and I don't. It's just nice to have a little bit more weight lifted off of our shoulders Like,
Not to worry about it.
yeah, yes, there's always going to be a risk in the hospital, you know,
Oh
with
yeah.
because we're always handling with blood and other fluids and stuff like that. But I don't know. It was also weird when I was just trying to find a job. Anyway,
Yeah.
like I do COVID testing, but I had this huge moral and dilemma, this internal conflict during winter break because I was like, man, it's crazy that me just wanting to, being passionate about helping people, trying to find a job to help people, there is a very big risk to
Yeah.
myself when doing that, and it creates that conflict that we were mentioning earlier. Yes, you know, having that drive to help other people, but also making sure that you're taking care of yourself and your
Yeah.
family. Like it's so hard to find that balance or that middle ground where you're okay risking a little bit of yourself in order to help other people.
Hmm.
But I think with having this COVID vaccine definitely does help with that.
Yeah, man. Like I think last semester, I talked about in previous podcasts about how I was doing COVID testing as like my public health rotation.
Mm-hmm.
My family was super worried the whole time. Like I was low key kind of worried too because I
Yeah.
never really wanted to. I was actually putting myself more at risk being exposed to someone with COVID, and it's just that experience just it was just really cool to be able to do testing and to be able to do something for the community. But at the same time, I was actually really putting myself out there and putting my family in danger, if
Mm.
anything. Despite having good PPE and everything, and despite following protocols, sometimes you just can't have expectations going in, and you can't really expect things to go perfectly, you
Mm-hmm.
know. And sometimes maybe something can happen, and maybe you contract it, and it'll just affect your family negatively. Which thank God that didn't happen. Um, but yeah, just having understanding of your limitations is really really good, and
Mm-hmm.
understanding whether or not you should go ahead and do something. Um, yeah.
Yeah, dude, what you said just kind of reminded me of like the day before my first shift, like doing this EMT COVID testing
Oh
thing.
yeah.
Like my mom was just praying the whole night. So was my grandmother, and then my dad was kind of chill about it, but then my mom was just super worried. Of course, you know. Plus, I'm an
Uh,
only child too, so I think,
okay. Yeah. 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 For
yeah,
sure. I
it's
feel that. I know.
yeah. So she was just super scared for me, and then her, you know, anxiety just brushed off on me, and I was just super scared. I was like, oh my god, am I doing the right thing? Am I just risking my
Yeah.
life? It make like I feel like when like a huge number of people in a small circle start getting worried and concerned, it just escalates everything. So yes, you know, even though I'm still a little bit worried, I do trust my PP, I trust my
Mhm,
coworkers, and you know my own knowledge and experience,
mhm,
but at the same time just having everyone around you so stressed and
mhm.
scared, it made me feel like I was, you know, risking my entire life for this. And it was just, I don't know, it was just so scary. And I completely understand anybody else who's going through that, where,
Yep.
you know, you want to take a job because it's an amazing opportunity to learn and experience
Mhm,
things in nursing school. But at the same time, there's a huge risk with that. And I don't know, I just feel like the best thing to do during those times is, I guess, reflect upon yourself and see whether or not you're ready for that. Talk with your family, talk with the people that you're going to be around most of the time off of work and off of school, and see if you guys are willing to take that risk if
mhm.
you know, get COVID.
Yeah. Like it is really scary because I had a COVID scare like literally right after I got discharged.
Oh yeah,
It's,
I
so
heard you say that. Yeah.
it's so dumb, man. So it's really interesting because I think my friend asked me to go get like celebratory boba,
Mm-hmm.
like of me getting discharged. So I think we only saw each other for like less than half an hour. Then I was back home just chilling, just resting. And I think a few days after, he was like, "Yeah, I tested positive, guys." I'm like, "What? No way, man! No way!
Oh,
Like, come on!
that's scary. Yeah.
Like I am immune compromised, especially with my condition. I'm literally taking antibiotics and everything, man.
Mm-hmm.
Like, uh, like you're literally trying to kill me." And he's like, he was so like apologetic and was like, "It's okay, man. Like, I doubt that it's we got it. That's just like the mentality I have to get to really get through it because I was holed up in my room for a good four days or something like waiting for my results and everything,
Mhm.
and having nothing to do and having a broken arm really did not help
That's
at
pretty
all.
real. I know you can't work out either. Oh
No, I
man,
can't work out either. I
bro.
can't do nothing, man.
You can do squats,
So
I guess.
no, dude. Oh my god. Like it was just really tough. And yeah, but interestingly enough, he got it twice more and he got a negative. So it could have been a false positive that he got the first time,
Mhm.
which even though rare, it's still a possibility, because everyone else tested negative, including myself. So it
Uh-huh.
was really interesting. We're like, huh, like you're the only one that tested positive, but
Yeah.
we all tested negative. You tested negative twice after. So should we believe the first one?
Mhm.
So like having that experience now too, it's just it helps me apply it to my future experiences in the
Mhm. Oh
hospital.
yeah,
Like
definitely.
you could as a nurse or as a student nurse, you can tell your nurse, like, oh, I think we should do it maybe one more time because maybe it wasn't as accurate, and
Mhm.
just to make the patient feel more at ease, things like
Yeah.
that. Um, yeah, it's just a super interesting experience,
Mhm.
because having COVID and everything is actually super scary too, and yeah, it is what it
Yeah.
is. It happened already, and I'm good. Like I was more worried about my family more than
Oh
anything
yeah.
because they were taking care of me.
Mhm.
Um, but it was super tough, man. They were giving me food outside the door,
Oh.
and I needed help to like put on my a cast sleeve so I can go shower. So I was like kind of putting my mom more at risk, but there was
Mhm.
just I couldn't do anything.
I know. You just put your
I
mask
needed her
on, just look
help.
the other
Yeah,
way, like
yeah. I literally that's what I
yeah,
did.
right.
I was like, I have put my mask on. She had a mask on. And she's only here for like 10 seconds, just to help me put it on, and that's
Mhm.
it. Like having no human interaction for those 2 days in the hospital, having no human interaction for the next 4 days, man. That was so tough. Let me tell you,
Yeah.
man. I can't. I was joking with my mom. I was like, hey, if I go to jail, I'm not gonna make it. Like
Oh my
I'm
god.
not gonna make it. I can't.
Honestly,
So
I feel like what you were feeling was a lot of how the seniors just in the general
yeah,
public are
dude.
feeling.
Yeah.
Yeah, like the way the where I do COVID testing, it's at these assisted living facilities and senior living facilities where a lot of the elderly, they're either alone most of the time or they have like their partner with them, but they're just in their
Yeah.
own separate rooms that they
Yeah.
just can't really leave. So when you enter, like, because when we do COVID testing, we like go in their room. So I'm like
Mhm.
fully gowned up and everything, and I go in their rooms. I just kind of sense how sad they are, but
Mhm.
also I feel like just how unresponsive they are. Just probably
Yeah.
more than usual because maybe for the longest time, these couple months, they've had nobody, just zero social interaction or like very few instances. And it's just heartbreaking for me to see that. You
Yeah.
just see like their eyes light up when a human just enters the room.
Yeah.
And it's weird because like, oh, I'm here to shove a Q-tip up your nose and leave. So it's heartbreaking. It's even more heartbreaking where like I only spend a couple of seconds with each one and then I have to go. Like, oh, of course I want to talk to them, but I have to go. And then it's crazy. It's
Yeah,
crazy.
dude. I have a pretty old grandparents that are still alive today, and living through the pandemic with
Mhm.
them was actually kind of really tough, because I can't go see them. And I'm like the grandson that usually go sees them and bring them some food or whatever, just because they were the ones like taking care of me as I grew up. You know, um, they're like my second parents, and being unable to see them has made me feel, more empathy for them
Mhm.
and more empathy for the senior population, because even though like some of them don't even have people come visit, and that's a really tough thing to go like get over and everything. And like those people that always had um family members come over, they just don't have that opportunity anymore,
Mhm.
and it's really unfortunate that that's a situation that we're in right now.
Yeah. And like you can tell how much their decline is accelerating as a result of this
Hmm.
pandemic. Just
I
I
agree.
think merely because of the lack of social interaction. Like whenever I go to like the malls or even my grandparents that live right next to me,
Mhm.
like not house, but like the next room over.
Mhm.
Like I can tell, like it's sad, but I can tell that they have declined a little bit more
Mhm.
because they're not able to just go out to the malls and see their friends of their
Mhm.
ages, you know. And yeah, I don't know. I don't know. I just feel horrible about that. That you know, they're not able to go out and do the things that help them stay healthy, like going out for, walked with their friends, maybe even play basketball, or just eat some food with them, just
Mhm.
walk around the mall and stay healthy. But
Yeah.
they're just unable to do that now as a result.
Yeah, my grandparents really looked forward to seeing their kids and their grandkids. And just having the pandemic, they're just not able to do that. And then
Mhm.
we're not having family gatherings, you know. We're not
Yeah.
seeing each other like that. So it's been really tough on them for sure. Because um at least for me, I know that I wasn't trying to worry them when I broke my arm
Mhm.
because they would go crazy, you know.
Yeah, I can imagine.
They would fucking go crazy if they knew what I if I if they knew that I broke my arm.
And stayed in the
So
hospital with
yeah, I
oh,
know, right? So for the first week or like 2 weeks or so, they didn't really know. I guess one of my aunts just told them at the end, and they just kept calling me like, "Oh, are you okay? Do you need this medication or this Eastern medicine that like
I know.
this ointment to rub on your arm?
Oh
Like
yeah.
you'll get better and everything. Just keep rubbing that for a week." I'm like, "It's cool, my guys. Like I'm good." I'm like, "Oh man, I feel so bad because
Yeah.
I miss them a lot too,
Hmm.
and I just want to go see them." Yeah, because they are getting a little older, and just yeah, that's also one of the things that make me want to go into geriatrics just because of them. Like
That's awesome.
I do believe that our older population deserves more
Oh
attention,
yeah.
better care. So
Hmm.
and they're like guiding me. Like my grandparents are like the ones paving the way for me to do that.
Hmm.
And I am really passionate about it.
That's awesome.
Yeah.
Man. And do you also feel like it's like a little transition, but do you also feel like you have declined in a way as a result of this
Oh,
pandemic?
like as
I
much
hate to
as
say it that way, but like I feel like that is a concern that I'm sure all of us are having.
I think not mentally declined too much. I think some of my skills definitely had taken a hit. Like I feel like if I were to talk to, a big group of friends and everything, I wouldn't be as articulate with my words.
Mhm.
Or if I go to I don't know. I feel like I've gotten more not intrinsic. What is it?
Introverted,
Introverted. Thank
Mhm.
you. I'm thinking.
Intrinsic. That's kind of deep,
I,
dude. That's pretty
yo,
deep.
dude, I'm in my nursing brain right now, bro. Let me tell you, shit. Yeah, I'm more fucking introverted, um, more than usual, in my opinion. Like, as more as I think about it, I'm less inclined to go to like big events because I just like being at home, or like I'd
Mhm.
rather go to something with like a few friends and like just hang out and just have conversations because
Yeah.
I think that's more important
Mhm.
nowadays. I do miss having that, but thank goodness for the internet and for meeting for Zoom and like Discord and everything, and for
Yeah.
gaming, because that's how I can connect with people that I haven't talked to in months, when we would talk, every day or like every other day after work, hours on end, because we just had that opportunity to.
Mhm.
Um, yeah, just like I think during the pandemic, it just made me think more about my connections with homies more than anything.
I feel like, I don't know, for me personally,
Mm-hmm.
I'm kind of scared because I don't play video games like
Mm-hmm.
at all. And I think, and all of my other friends do. So I think a concern that I've always had, and it's just getting exacerbated more lately, is just I feel like I'm losing my connection with them because I don't know. I know it's my fault though because I just am not willing to participate in the video games.
It's just not your
It,
thing. No,
it's just
I
not my
totally
thing.
understand.
It's because
This is cool.
yeah, because before the
Not your thing.
pandemic, like we were so good, all good together because we would always grab food, boba, and
Mm-hmm.
like the main thing was sports. Like
Yeah.
they knew how much I love sports, so whenever I wanted to go out and play badminton, ping pong, spike ball,
Mm-hmm.
whatever with them, they were always down.
Mm-hmm.
But then we just can't really do that anymore.
Yeah.
So
It's
I yeah. So some of my best friends, literally some of my most best friends that I'm like will be like my groomsmen at my wedding. Some of them
Yeah.
I haven't talked to them in like a month or two, honestly.
Yeah.
It's kind of sad. I just like, man, what am I doing? I feel so bad because I know they're within arm's reach, like on Discord.
Yeah.
But
Yeah.
then at the same, for some reason, I just can't. Like I think I'm so stuck in, how I've grown up these past 20 years of, real life interactions, and I'm unable to just adapt. Even though it's been almost a year, I'm still feel like I'm just not able to adapt to the virtual world quite yet.
Yeah. I feel that. It's a really different experience. Like if you had no experience coming in with like that online experience, like having the gaming background or having the ability to, connect with people online via Skype, via Discord, it's
Mhm.
just really different. It's really hard
Yeah.
to get into. And it's just really different too,
Yeah.
honestly, because when at least when you're not in the online world and you're thinking about other things that's going on in the real world. Like you can talk
Mhm.
about your nursing experience, and like you can talk about what happened at work, but you
Yeah.
don't, have work. You don't
Mhm.
have that nursing
Yeah.
experience at least for right
It's
now. You
yeah.
know, and y'all can't even go get the food.
Hmm.
Know? Like
Yeah.
that's really tough too.
Yeah.
Just like being unable to have those same experiences to really talk about with the homies
Yeah.
really takes a toll
And
on a lot of relationships. I think.
yeah, and also I just feel like something that I've noticed in my very short amount of times that I've done Discord calls or
Mhm.
Skype or whatever, it's honestly I feel like it's super hard to focus on the conversation because
Yeah.
you're not all within, in each other's proximity. You're all there's like
Yeah.
the whole room around you. You have a computer screen that might
Yeah.
distract
Yeah.
you, whatever. That's why my favorite thing in the world is conversations in a car. Because I think you're
Yeah.
all
Yeah.
just trapped in that
Yeah. In the
car
car.
and like there's literally nothing else to do except talk, and I absolutely
Yeah.
love it. Like I love it so much.
Yeah.
Like
Just listen to music and just have conversations.
yeah, I
Yeah,
really miss those days, man.
I do. But
Yeah.
hopefully that everything goes smoothly. And ooh, very exciting news. We have a new president. So hopefully
Oh
that
yeah.
he will be able to, distribute vaccines as quickly as possible
Hmm.
so we at least can go back to some sort of like normal,
Yeah. Like I don't see masks ever going away anytime soon, but I
Mm,
definitely am hopeful for like, the far future where we can all just meet up and actually just shoot the
mhm.
shit in real life.
Yeah, like you talking about masks. I really don't mind wearing masks.
Hmm.
Like I think it's cool. Like if you're sick, just put on a mask. That's the best thing to do.
And I feel
Like
like I'm the probably like I don't know. I haven't not gotten sick really, and it's been nice.
yeah, yeah, yeah.
Or just allergies. I'm like I get like major allergies,
Mm,
but like this season, I've been,
it's a lot better.
it's way better. Like I haven't gotten like the stuff that I usually do. Gotten. It's so
Yeah,
nice.
that's good.
But
That's
like
good to hear.
I just want to see your face, bro, when I'm talking to you. I know
I
it's
know, I
in
know,
real
I
life.
know.
I know it's like a weird thing, but I'm just like, bro, I just like what happened? I feel like it's that mask really is like a mask to like having a deeper connection with someone
Yeah,
else.
I just
That's
seeing
just
your
like
face and everything. Yeah,
yeah. But we'll get there one day.
yeah,
Yeah. I don't know. I guess we can end it off here. Do you have
sure.
any lasting words, Alan, to say
Oh
about?
man, I'm just excited to start the new school year. I know it's gonna be a little tough on us this semester, but I have the homies and I have enough confidence that we're all gonna make it through. So I'm not that. I'm pretty chill about it.
Yeah,
Yeah.
I don't know. I have my own reservations about this semester, but I think I'm just like
Yeah.
I think I'm excited to just get back on. I know it's like I hate getting back on the grind, but like at the same time I'm kind of excited to just
Yeah.
like
Because we're
I
so
don't know.
close, Like
It's
I
we're
don't
so
mind going back
close.
on the grind because we're
Uh-huh.
so close.
Yeah, and
Yeah.
also it's just like I don't know. I feel like these past 7 weeks when I wasn't working, I was like just numb to everything. I was just like chilling on my, watching
Yeah, I
Netflix or
agree.
whatever. But
I
then just to
agree.
have shit to do, I really hope that we get a longer and more in depth clinical experience
Mhm,
compared to what the previous junior twos got. I think
mhm,
I don't know. I'm really because I think there really needs to be a balance in nursing school between
mhm.
what we learn in lecture to what we do. And I feel like if
Yeah.
you know, pile us on with so many lectures and what we need to study and all that, but you don't give us opportunities to utilize those skills out in clinical,
There's no point. Yeah.
there's no point. We're gonna get burnt out. We're gonna be a lot more lazy, in my experience, especially. But if you give us that opportunity to see those patients, to see or like, I guess, reconnect with our purpose for why we want to help people, then you're gonna give us that much more motivation to actually learn and lecture.
Yeah, you'll learn a lot more on the floor, and I agree that will really help out academically too.
Yeah.
You get a lot more insight and you understand everything better.
Yeah.
Mhm.
Yeah. Thanks everyone for listening.
Well,
I don't know what
yeah,
else.
appreciate everyone coming in. I know we've been taking a long break, but we've been getting ready to get back on the grind.
Yeah.
So yeah, I'm glad. Thank you for making it to the end. Big props to you guys.
Yeah,
and
shout out to them.
Yeah, shout out to you guys, and I guess we'll see you guys in the future episodes.
Thank you very much. See ya.